Congressman Andy Biggs is here. Good afternoon, Mr. Biggs.
Hey, good afternoon, Jimmy. And if I'm Joe Montana, you're Steve Young coming up, and that's fantastic.
Listen, man, no one who's ever hung out with me knows I couldn't survive on the Brigham Young campus for 2 days. I can't be Steve Young, man. I think I drink a little too much to go to BYU.
Jim McMahon, then. You might be Jim McMahon. There you
go. that's a little more. That's a little more apropos. The headbands, the bad haircuts. I like what you did there. So you're all over the map. You've got two big opinion pieces out right now. One of them, of course, questioning Dr. Fauci's usefulness at this point. The other, urging us to reopen the economy. So I should cut right to the question on every voter's mind. Have you watched Tiger King yet?
I have not. I missed it.
You're still working. Listen, in your defense, and I am reassured whenever I ask a representative about this question, I am heartened to hear that there are some of you that are still out there trying to work and get this thing turned around. It does make me feel a little bit better. When, as it pertains to your writing, when do we open this thing? What are you thinking?
We should have opened last week. I mean, think about this. You've got grocery stores, for Pete's sakes, and we somehow managed to socially distance and get the groceries distributed and get people out. But I'm telling you, I've got people in retail shops all over my district, all over Arizona, all over the country that I hear from. And they can't do the same thing that the allowed grocery stores do. So they're going under. They may not qualify for some of the federal relief. This thing has got to be turned around because, look, you're going to have probably, Jimmy, my guess is when the next unemployment numbers come out, you're going to be 19 to 20 million people unemployed in this country.
Wow.
And, that's depression level. And you've also, the package that just came out, we asked Mnuchin this question. Hey, here's what happens, man. You got people that 8-10 weeks in, you've got the guys who borrowed your money, your relief money, and their employees won't come back to work. So then they don't get the break on that. They've had to pay it out, and they aren't going to come back because they're making more money on unemployment than they're going to make on coming back to work. And so they're not incentivized to come back to work.
It's a valid concern. I think a lot of people have in terms of incentivized unemployment. I guess the bigger challenge here, I guess what you're espousing, though, as I read it in your op-ed, is that we're getting to that place now, that junction where the economic consequences could impose a bigger physical burden than the disease. Are we getting close to that point yet?
Yeah, I think we're there.
Oh, wow.
I think we're there. Look, let's talk about rural hospitals.
Mm-hmm.
We've got rural hospitals whose lifeblood is elective surgeries.
Mm-hmm.
We've got counties in Arizona that have a very, very few people with the virus and nobody in their ICU, nobody in the hospital. They're shutting down. They're losing $40 million, $50 million a month. Mm-hmm. They're going to fire, and there's one hospital that's going to have to furlough 400 employees in a small community.
Wow.
And you just think about it. Well, I just heard from literally before I got on with you, Jimmy, I got a text message from someone who's got cancer, and the treatment she needs has been deemed elective, so she can't get in and get that taken care of.
Uh-huh.
At the same time, we're seeing hospitals that are furloughing employees, for sakes. This is just absolutely upside down.
Yeah. Well, I guess, one of the interesting points you made is that a lot of these lockdowns were based on modeling that they've since told us was incorrect. Dr. Fauci said, we've adjusted downward what the predictions were going to be. So how come they're not having a proportional reaction to the proportionally adjusted models?
I can't explain it. Okay. I really can't explain it. I mean, Fauci said a little over a week ago that he doesn't trust any of the models anymore because they've all proven to be unreliable.
Mm-hmm.
Well, when you start looking at some of what's happening elsewhere, and here you are seeing this move down with the case fatality rate that's going to be somewhere very near a common flu season. And Probably some of that's because of the social distancing, better hygiene practices, et cetera.
Mm-hmm.
But at some point, we're going to have the undesired effect everywhere else that happens when you have move to depression and people have to make hard economic decisions.
Yeah, listen, I do feel for you guys because you're in a position where these are life and death decisions being made. So I guess it is good that you're not watching so much Tiger King. But as it pertains to this big debate yesterday of the president saying he has full and total authority, who ultimately does decide when these states reopen? Is it a state-by-state call, or is there some type of coordination between the White House and the governors?
Well, I'm a big believer that the people of the United States hold the power to reopen this thing.
Okay.
That's anybody who's in an elected office serves at the pleasure of the people of America.
Uh-huh.
I mean, that's crystal clear. That's inherent. But I will just tell you, to get to your specific question, you've got governors who've made, in my opinion, overreactionary economic decisions that have basically taken businesses and property from people. And so the states should be on the hook for that. But in the meantime, the states have gone to the federal government. This is part of the upside downness of this whole thing that's been going on for decades here. So the states go to the feds. The feds then try to impose criteria, requirements, mandates at the same time that they're providing all kinds of material and expertise. And then the states say, well, now, okay, we got it. We don't want it from you. In reality, the states' governors should be making these decisions. Many of them have made decisions, however, without constitutional or legal authority. Wow. So we are in a scrambled big mess right now. And I think the president's trying to make the point, hey, look, you've come to us, and we need to get this thing open sooner rather than later. And then you've got the governor saying, well, wait, we want to make the decision. And I think ultimately it is a state's decision to make, but they're going to have to own. They're going to have to own what the federal government has given them, and this is we have to take this back, Jimmy. This is a bigger question. Ultimately, when we get through this, can we ever get back to what was intended to be American federalism?
Yeah. Which is, not such a massive reliance on the government. I mean, essentially, that's what you're pushing here. Isn't that what's interesting to me that you bring that up? Because everyone criticizing the government's reaction to this the most happens to belong to a party that would like to see the government running their health care. Aren't they? Isn't it kind of like a self-own, so to speak? Aren't they defeating their own point in doing that?
Well, they are for people like you who look at this. This is a nice compliment I'm about to give you. Who look at this logically and rationally. I mean, you cannot make the argument that we need more government because the government has done a terrible job. I mean, that's really what the argument boils down to, and that just frankly doesn't fly. That's the old argument that they made. Well, yeah, communism works great. It's just never been tried in the right way yet. We've just never seen it the right way.
Oh, man. It's not good, but I am taking that compliment and putting it in my file because it's the only one I have, so I have to.
It's are you saying it's lonely?
Yeah, I don't mean to. My compliments have been social distancing on this show. There's not a lot of them hanging out, so I gotta run with that. But no, it's a brilliant point that you make. Is that the government, the inability of the government to react to things in a nimble way is not specific to administration. It's specific to the size of bureaucracy, correct?
Correct. Yeah,
okay.
Absolutely.
And that's the part that's frustrating me, is because there's been such an effort to characterize this as a response specific to the president himself. But I think the general takeaway from objective people is he is listening to his experts. You would almost argue he's listening too much because Fauci isn't exactly throwing a perfect game, is he?
No, yeah. Fauci started off, if you remember, just a couple of months ago saying, hey, we don't have to do anything different. This is going to be great. President Trump put in a travel ban from China, and he was called xenophobe and racist by Biden and all the Democrats. This has just been politicized from day one from our colleagues. Oh, by the way, when this was first getting notoriety in the United States, you and I didn't really hear about it too much because They were impeaching the president. So this notion that it's owned by President Trump, I think he's done actually a pretty good job. I do think that as we've moved into this notion of technocrats running the country, or trying to run the country, that's what Fauci and Birx are.
Yeah.
They don't. I mean, they've said we haven't looked at societal costs. We haven't looked at economic costs. We haven't looked at the mental stress and issues that may come. We're just looking at the coronavirus and how we would do it. And basically, they'd be happy. I mean, Birx said last week that you might need to keep this thing closed till November.
Stop it.
That's just ridiculous.
Yeah, there's that at some point you'd see revolution in the street, because people there's a general feeling of helplessness, even by people who have jobs that can do them from home, that they're really powerless over their own lives right now. And
yeah.
I think at some point you can't subject people to that for a prolonged amount of time without getting a negative consequence. And I think we're close to that. I mean, my hope is that we get some good data this week, hopefully next week by the latest, and we're ready to open this thing in May. The problem is it's hard to have a fair conversation now, because people like you who are saying, hey, we want to open the economy because we're concerned about people's health. I was reading an op-ed where someone said Congressman Andy Biggs wants you to die for the economy. How do you have a conversation in that environment?
Oh, man, so many weird things are said about me that I don't even pay attention to that anymore. But I tell my wife all the time, I can't have a logical debate with people who are living in emotion land. They just they're virtue signaling. Every response is visceral, and none of it. They accuse me of not looking at science. I am looking at science. I'm looking at the models that keep changing and getting revised down. I'm talking to medical officials. I'm getting briefed almost every day, for Pete's sakes, from these folks. And I can tell you, my position is extrapolating what they're saying is we're moving to a position where we're ready to open. We should be opening. And if we wait 2 more weeks and you get 20 to 25 million people unemployed in 2 more weeks, and you see literally thousands of businesses closed down, life savings wiped out, you tell me what the mental and physical stress pressure is going to be as we see a rise in child abuse, domestic violence, drug use, suicides. These things are starting to happen. Oh. And my friends who don't want to open up this economy and get us back to being who we are, just don't get it, in my opinion.
No, I'm with you all the way. I'm 50-50 right now that my wife is going to kill me in my sleep if we don't leave the house soon. It's coming. I just want it out there on the air so everybody knows she's a suspect when it goes down. Yeah, we got to get back outside. Congressman Andy Biggs, always a stellar appearance. Another Joe Montana-esque performance here, so this bud's for you.
Thanks, Jimmy. I appreciate it.
I'll talk to you soon. There he goes, the great Congressman Andy Biggs, having a grown-up conversation. Guy's tailor-made for Fox Across America, because there's a lot more nuance to this stuff than people's emotions would have you think. So we really do appreciate him coming onto the show.